Number 6, another thing you should know is that you don't get as much practical training as you should get, because what we learn in school and what we see on the practical training are, if from my experience, are completely different. You only get to practice the practical procedure on your practical training, and when you don't have practical training, you often forget, or so it's important to repeat the stuff you're learning. My tip there is that you can practice on your friends or family the different moments, like maybe not taking blood pressures and that's not that hard. For example, peripheral venous catheter, I think is that what it's called. How you're supposed to do with your hands. It's like driving a car. Practice this into your system, how you're doing with your hands and stuff. First you put your needle in, and then you take out the needle and push in the plastic needle, and then blood will come out. So you have to, all these things you have to. Maybe you can look for veins, touch and feel the veins. Like I have one here, right here. I don't know if you can see, and you can just practice feeling the vein, or like taking like blood tests, and how you'll do with your hands. Like practice this, always. There are also a lot of good videos, on YouTube with instructions to the different procedures. It's always good to repeat, especially if you're about to go to your clinicals. Maybe watch instructions on the different procedure just one time, so you have it it's fresh in your memory. It's important to practice and repeat stuff during your nursing school. Number 7, another thing is that your clinicals, I know there are a lot of things about clinicals, but the clinicals are where you're practicing your nursing skill. So that's why that's a big theme in this 10 things to know. Your clinicals will take a lot of time and you'll get exhausted. In Sweden, it is very strict with time and stuff, so you have to put it right in your time, where your supervisor is supposed to put his or her signature on it every day, and and top of that you have a lot of essays to do, and it's just a lot of stuff you have to do at the same time. So you're really you don't have time for anything else. I didn't have time for the gym or meeting my family. It's that. I don't know how it's in other countries, but in Sweden the clinicals are like that. You don't have time for anything else. You only have time to come home, sleep, maybe do some meals for the rest of the week, but you don't have time for anything else. And my tip there is to plan these weeks in the clinicals. Is that the first week you don't do anything. You just watch and get to know your colleagues and get to know your placement. You get to know their routines and stuff, and don't focus on anything else. Don't focus on the essays or anything, because you're the first week you get so much input from new placement that it would just be overwhelming thinking about the essays too. So just take it easy and just get to know your environment first week. And the second week, maybe our essays, I don't know about other country, but in Sweden the essays are mainly about you choose a patient that you're taking care of, and then your essay is based on that patient. So in the second week you can maybe choose which patient you're supposed to write about. I don't know if it's optional. I think it's different from placement to placement. Some placement, the supervisors choose the patient for you, and in some other placements you can choose yourself. But you can always tell your supervisor that you'd like a patient in week 2, so you can get to know that patient a little more and study about the patient's illnesses and stuff, and also try to do procedures on your own, easy stuff like blood pressure or taking vital parameters, for example. You try to jump in and say, man, I can do that, can I do that? Like you only telling your supervisor that you want to do stuff, and if the supervisor is not that committed, you can just try on your own, or you go to another nurse and say, well, hey, can I be with you today? Like, and the rest of the weeks, just pretend that you are a nurse on your own. But this is very important. If you're unsure about something, you have to ask. You have to ask someone, because they can have consequences for the patient. So only do stuff if you're sure about things, and ask your colleagues have been there like many years. They're expert on their placement. If you're not sure where to get things or how to do something, just ask them. And if you're really not sure, just say that. Well, you can just say that you're not sure and you don't want to do that, and maybe you can do something else. But try to use that time, because after the 3 years you'll be alone, and you can practice. You have to do everything on your own. Number 8, another important thing is that you should never compare yourself with other students. I know that after exams you're like, oh, what did you get and what did you answer on this question? Just don't think about that, because in Sweden it only matters if you pass, because in Sweden there is a lack of nurses, so we are wanted everywhere. So you don't have to have A plus or anything on exam or a procedure or examination. You only need to pass, so don't push yourself that hard. Another thing is that people are unique, so we all learn in our own pace, and some are better on practical stuff, some are better on drug calculation, but we're all different, and we will all learn everything during the 3 years. Some we learn in different paces, and you shouldn't feel guilt or shame that you couldn't do something, because eventually you will learn it. So just take it easy and just do your best, but you don't have to push yourself that hard. Everything will be alright. Number 9. Okay, another thing you should know, and it's good to know, is that you'll come a far way just smiling at your teachers and talking to them, asking about the day and stuff. I know people say that it doesn't work, but it does. I know that some of my fellow students that study with me, there have been some injustice there in grades and stuff, because when I have these seminars, the teacher didn't remember the names, so he switched the names and just guessed the grade. So, and I was lucky because I smile and I talk to, so the teacher remember my name. Came a long way with that. So I know people say that it doesn't work, but it does work. In the seminar, people that perform better didn't get the better grade. And I've seen a lot of stuff like that. You don't have to be mean to the teachers, but it doesn't hurt to say hi or good morning or how was your day, how did you celebrate Christmas. It doesn't hurt. You can do that and let the teacher think that you're a sucker, but it does help. For me, even it went to that extent that the teacher helped me by encouraging me. For example, in seminars and stuff, if the teacher noticed that I was too quiet, he would Yutika, what do you think about this? So that I could pass that seminar, because I'm a shy person, so I have hard time taking place and stuff. I think I know more than I think, and I have had a hard time expressing it because I'm so shy. And he knows that, so he asked me directly. That's why he knew, he asked me directly, Yutika, what do you think about this? And then I could speak up. So in that way, he encouraged me. Number 10. And the last thing you should know, and it's the most important thing of of all the 10 things. You should always take care of yourself and be healthy and do things that you think is fun. You should have a hobby or anything. I don't know, meet friends or anything. You shouldn't eliminate those things. And it doesn't just apply to nursing studies. It applies to life overall. Like the main things is that you're okay and you're happy. If you feel like in the first year that, oh my god, this is not my thing, it isn't your thing. So maybe you should rethink this. Many people, like, they don't have if you want to be a nurse, you have to be able to feel with other persons. In our nursing school, we have exams on how to treat other persons as a nurse, but those criterias are kind of natural. Like of course you should feel empathy with your patients. Like there isn't something that you're supposed to like study to. And we have too many people that are not caring in our profession in Sweden. I can say that because I met another my supervisors even that like doesn't care about the patient. Like, you should have a hobby, drink, never forget to drink. I know we we're caring, so we take care of other people, but we can't forget ourselves in that. We have to stay healthy and be okay. And drink water, don't forget to drink water, especially in your clinicals. Just have a water bottle with you wherever you go. And you should eat, don't forget to eat. Have something fun to do on your weekends. Something small, something big, but you can relax, you have to, don't push yourself too hard, just take care of yourself. So that's the most important tip that I have for you. So yeah, that was 10 things you should know before starting nursing school, and I hope it helped. And if you have any questions, you can always email me or write in the comment box. And if you like this video, don't forget to like and subscribe. Yeah, we'll see you in the next one.